It is World AIDS Day, the day
was first marked in 1988. In a statement, President Biden recommitting his administration to ending the HIV epidemic. He added the world is within striking distance of eliminating HIV transmission. Joining us now is HIV expert Dr. Ryan Westergaard from UW Health. As of 2020, nearly 7,000 people are known to be living with HIV in Wisconsin. How is the diagnosis rate trending in our state?
It's been stubbornly flat. Unfortunately, we have about 240 to 260 new cases per year. It's been that way for about the last decade, despite us having tools to reduce it further. So I agree with the White House argument that we have everything we need to be able to get transmission even lower. We just need to put them into practice.
When AIDS first appeared, it was considered an instant death sentence. How is medicine now helping patients live fuller lives?
It's completely different. For about the last 20, 25 years, we've had medications that directly target the virus that can drive the HIV virus to undetectable levels in the body. And when we do that, people can live a long, healthy life and have no concerns about developing AIDS or other health complications. So the main message from that is that people need to get tested if they're at risk, and early linkage to care, because once someone is diagnosed, we can get them on treatment that will keep them safe and healthy for a long time.
And despite the advances, HIV positive people can still face discrimination. What's being done to counter that?
Well, there's a lot of partners, particularly here in Wisconsin and in Milwaukee in particular, that have been working very hard in collaboration with community groups, local tribal health departments, to directly outreach communities like the LGBTQ community, people of color who have elevated incidence and risk of HIV infection, help them understand the resources that are available to get tested and linked to treatment if positive. And that's what it's going to take. Right now, in Wisconsin, we're lower than many of our neighboring states in terms of how many cases we have, but the unacceptable data shows that people who are racial and ethnic minorities in Wisconsin comprise about 2/3 of the new cases, even though they comprise only about 19% of the population. So there's a lot more work that needs to be done to make sure that the resources we have to prevent HIV are equitably distributed across our state.
All right, Dr. Ryan Westergaard, thank you so much from UW Health.